Good morning. If everyone will find a seat, we will get started. Okay, I may have to ask for the Ted Mitchell whistle here in a minute. Okay, we will go ahead and get started. I don't know about y'all, but this feels like just a good old West Texas family reunion. What do y'all think? Well, good morning. I'm Dr. Lori Rice Spearman, president of the Texas Tech University Health Sciences Center, and I'm honored that you've joined us this morning to celebrate commemorating a historic milestone for our great university. Today, we publicly celebrate the opening of the Julia Jones Mathews School of Population and Public Health, the sixth school for the Texas Tech University Health Sciences Center, and the third school for our Abilene campus. While today's celebration is about opening a new school, we also want to focus on its impact. Population and public health is an emerging collaboration of two very vital fields for the future of healthcare. One focuses on identifying potential health concerns, enhancing care management, and addressing social determinants of health through data analysis. The other plays a critical role in promoting health, preventing disease, and empowering individuals to implement changes for better health outcomes. Together, they offer a unique blend of research inquiry and bringing together people from multiple disciplines to discover health problems and develop innovative solutions that improve our quality of life. You'll hear more about these disciplines in just a few moments from our acting dean. But I want to recognize a few special guests who have joined us today for this celebration. We have key people in this room, and I want you, as we go through the program today and think about things, I want you to keep in mind that almost 20 years ago, 18 to be specific, a group of city leaders came together with a vision and to do what they needed to do to grow impact in the Abilene community and the health of their community. We are here today because of their tenacity and their determination to execute that vision. What a gift for us to be able to be here 20 years later and be a part of this very special moment for our university and this community. So with that, I want to introduce some individuals to you. I want to introduce our Chancellor, Ted Mitchell, who was on the ground in those early conversations. Dr. Mitchell, thank you. We also have two former regents with us, Regent Tim Lancaster and Regent Scott Deeser, both here today. And then we also have some individuals from our leadership team and our campuses across our great university, because this just isn't a celebration for Abilene, Texas. This isn't a celebration for our entire enterprise. We have folks here from Lubbock, from Amarillo, from all of our campuses here to celebrate today. I would like to have Dr. Phillips, who's going to be speaking later, our acting dean, but he's also the executive senior vice president for our F. Marie Hall Institute of Rural Health. And as great as Billy is, we've got about 20 names to read out. So if y'all want to wait until I get to the end of those 20, we'll applaud them. We have Dr. Pearl Merritt, our regional dean here for the School of Nursing. Pearl, I know she's here. She can wave. We have Sarah Browse, who's also one of our regional deans. We have Dr. Dondra Seacrest here from our Lubbock campus, who's our dean of the School of Health Professions. We have Dr. Branch Snyder, who's the dean of our Graduate School of Biomedical Sciences. Brant was given the opportunity by our chancellor to help grow the Department of Public Health. And Brant, you've done a wonderful job. You've birthed this baby and handed it off. You did wonderful. And then we also have our newest dean, Dr. Grace Quo, who comes to us from our Abilene campus. She's the dean of the School of Pharmacy. Now then, moving on, cabinet members. We have Cindy Jumper, who's our Vice President for Government Relations. She's joining us today, along with our Vice President for External Affairs, Ashley Ham, our Executive Chief of Staff, Cole Johnson, our Vice President for DEI, Jody Randall. We have Sean Cruzy here representing our Office of the Provost, and we have Dr. McMahon here as well, I believe, yes, who is our Senior Vice President for Research and Innovation. We are honored to have the Mathews family here with us today to hear more of a story about your wonderful mom, Chris and Cade Mathews. We have another one of the original visionaries here today, Joed Cannon, which is going to be part of our program to tell a story as well. We have Brad Holland here, who's the CEO of Hendrick Hospital and a wonderful partner for Texas Tech University Health Sciences Center. We have our Mayor Emeritus here, Mr. Norm Archibald, who is also part of the visionary team. And then we have our CEO for the Texas Tech Physicians, Mr. Brent Majors, who's also joining us as all, again, demonstrating our commitment as a university. Thank you. Before we continue sharing more about the new school, I want to point out that our Vital Spirit Shop is on site today with exclusive new merchandise for the Julia Jones Mathews School of Population and Public Health. We hope that you will partake of the merchandise. We want to brand individuals and have them all over town talking about this new school for the Texas Tech University Health Sciences Center. As I mentioned today, our celebration is about the next milestone for our university history. But also, before we go too far into the history, I also want you to know we are also looking forward to the future of the Texas Tech Health Sciences Center in this community. We have a vision to continue to grow here and to build collaborations with our sister universities in this community so that we can continue to raise the status of healthcare in Abilene and our next frontier in research in Abilene, which we're very excited about. I just got goosebumps. Okay. Okay, our next opportunity is about the One Health program. One Health is a unique concept that has been developed by the Texas Tech University system. We are one of only 9 systems in the entire United States who consist of a veterinary school, a medical school, a pharmacy school, all and a law school, all in a complement of a single system. We are going to leverage that, and the Abilene community is going to be part of that for us. The foundation of the One Health program are when humans and animals and agriculture intersect and what happens with healthcare when that occurs. The Julia Jones Mathews School will be the foundation of what we are going to be doing with One Health and bringing all these disciplines together. And so we are very excited about that foundation being here in Abilene, Texas. Okay, so let's talk about the calling. It takes a special calling for those who come to learn about population and public health from our experts and our renowned faculty. And we have our faculty here today who will be recognized later. Still, their efforts will lead to practice relationships with public health authorities for West Texas and beyond. We all learned how important public health was during the last pandemic. We relied heavily on our public health officials to help guide us as communities on the best way to make sure that we were keeping each other safe and secure and moving forward with the best information that we had at the time. With this, I'm very pleased to welcome Dr. Billy Phillips, our acting dean for the Julia Jones Mathews School of Population and Public Health. As I mentioned earlier, Billy also serves as Executive Vice President of the F. Marie Hall Institute for Rural and Community Health. He has led a number of pioneering programs since joining our HSC 13 years ago, bringing innovation through technology and community-based solutions to our region. His pioneering spirit, along with a strong academic tenure and background in interdisciplinary population and public health, made him the ideal choice as acting dean. As acting dean, Dr. Phillips has led the development of our new school and fully understands the successes we've had to date in academic programming and the opportunities that lie ahead. His leadership will help ensure a strong foundation for the school and its progress during our search for the inaugural dean. Billy, thank you for saying yes. Please come to the podium.
Good morning, everybody. It's a great day to be in Abilene, Texas, and I am so grateful to have this opportunity to speak for a minute. My role today is really to thank some people who have preceded me, and I'll begin with Dr. Lori Rice Spearman. I don't know if you know it, but we all love working for you. Your energy, your vision, your grace, that just inspires all of us, so thank you very much for that. We're missing Dr. Darren D'Agostino, our provost, and he is not able to be here today for health reasons, but he's on the mend. But we're thinking about him. He's one of these folks that has big dreams, lots of energy, and just gives us that same energy, and so we go forward and do what we can do, and this is an important part of what we do. I also want to thank our facilities team who put all of this together. Adam's around here somewhere. I don't know how many times they practiced the unveiling, but quite a few. I didn't know if somebody was going to come off that roof or not, but we had some parachutes available, so anyway, it worked out well. And Ashley Ham, thank you so much, and your team for putting the tent up and arranging all the stuff and scripts and all that other good stuff. Thank you so much. The behind the scenes is amazing. I wish you all could see that. And I'm humbled by what you all have done. Thank you so much. Brant, thank you. Brant Snyder sitting right there, and he birthed this baby, and we're so grateful for your leadership, along with Pam Johnson and Dr. Mike Blanton. Thank you again for that leadership. You know, this is a great place to do what we're going to do. I personally love Abilene, Texas. I remember when Chancellor Mitchell and Mr. Lancaster were in different roles at that time, but I always loved to travel with the Chancellor when he was president. You know, we would always have fun. And I asked what we were going there for, and he said, well, we're going to have a new school one of these days, and I think that we have a partnership to build. And you know what? I got to see that and be a part of that. Larry Gill was there. Norm was the mayor, and so what a tremendous opportunity that was personally for me and for this community. You know, we're going to develop from our very strong public health program a variety of other opportunities. Right now we have a great program with the School of Pharmacy. We have 4 students in that. They're doing PharmD and MPHs and will be double prepared in their primary field and in public health. And we also have this One Health concept that we're going to develop, which will be intriguing to many. I think we're going to be the only ones in Texas who will really actually have the capacity to pull that off. Our long-term goal is to build out degree programs in this school to give every graduate of any program in the university an opportunity to come and take a degree with us. That is a bold vision, and it's appropriate for the heart of Texas. We will achieve that, and we'll go forward and make the next workforce for our communities. Throughout this process, one of the most pressing questions that I've been asked is, well, what is this thing, population and public health? We've heard of public health. Everybody's heard of public health. What is population health? You know, and by the way, those of you who wrote this script, don't get nervous. I'm not going to use your script, but I am going to tell you what it is. The truth is that population public health are really separate fields, but aligned. They're allies. And in population health, we provide a scientific basis to discern patterns and approaches and interventions that are data-driven. It's evidence-based. It's the best we know of the science. And in public health, we take that information and we practice that with community people and make changes that are life-saving. We are unique in the opportunity to influence all the way from prevention so that nothing happens but good things. And that's so appropriate for this community and for the Mathews family. Julia Jones Mathews, I don't know her, never did, but I wish I did. Because what I've done since I've been here is drive around this community and see the many good things that she has done in this community. And this is another one of those things. And so what a nice tribute to her vision, her belief that Abilene should be the leader in innovation, and she put her treasure to that, and her family's support for that. So thank you all very much again for what a wonderful thing. You know, you're really known by the people that graduate from your programs, and I'm happy to introduce to you, you know her, your own public health director, who is our alumni. Annette Lerma is here. I don't know where she is, but there she is right back there. She is tireless in all the right ways, diplomatic, and led through the hardest time I could think of in COVID-19, and did it all with diplomacy and a good outcome for your community. So we're very grateful. So I'm going to close up this part with just this simple idea. It's really going to take a team. Policy people will have to be on that team. People who like to crunch numbers and look at trends and, deal with that part of it. And people who like to practice in the communities and get the folks that are living it to be a part of the solution to whatever that problem is. And, those communities are all over the place, and especially in West Texas. So it's going to take us all, and yet I look around this audience today, and I feel very optimistic about our chances to accomplish all the greatest things that we want to do. I said when I came to Texas Tech University Health Science Center, there wasn't anything between me and what I wanted to accomplish but maybe one fence post somewhere up north of Amarillo. No impediments whatsoever. And I look around and I'm confident there are no impediments here either. So thank you. I want to also speak on behalf of our 225 graduates and our current students, and I want to recognize somebody very important. She's the one who had the vision that the rest of us have captured for a school of population and public health. She wrote a plan that we've now taken far beyond what was probably intended, and that's Dr. Teresa Bird. And I know she's here because I hugged her earlier. Dr. Bird, right over there. Dr. Bird is the chair of the Department of Public Health. She's nationally known for her work, and she's bringing a new program here to Abilene to identify early stage colorectal cancer so that we can take it out, prevent downstream bad ideas that come from that. Also, I want to recognize a terrific faculty. You may see them because we're all wearing this shirt on purpose, and we'll be glad to take you around the building and get you water and do all those things you would like to have us do because we're here to serve you. And so when I call your name, would you all just identify yourselves? Dr. Kahn, Dr. St. John is in the back there. Dr. St. John has practiced in this community since the beginning. Dr. Lisa Gittner, Dr. Jeff Dennis back there. Dr. Passapathi is away visiting with her sick mother. Dr. Appia and Dr. Courtney Queen. Dr. Queen is an Abilenian who has just returned, I believe, yesterday from Latvia, where she's been a Fulbright Scholar. So we have a terrific faculty, and I hope I didn't leave anybody out on the faculty. Just great people who love to teach and love to nurture and take their students forward in their educational journey. You know, none of it would be possible if we didn't have a terrific staff, and some of them are here today, so let me recognize them. In Lubbock, it's Beverly Bowen over there next to Dr. Dennis, Lisa Wyatt, I saw her earlier today, and John Baker, and I don't think John was able to make it, but those are the folks that are behind the scene in Lubbock. And here in Abilene, we have Mr. Aaron Brooks, who's our IT guy. Aaron, where are you? There he is, way out in the parking lot. Mr. Patrick Lloyd, who is one of the most effective advocates for our students, and Corey Patterson, who is in charge of our recruitment and marketing of the program. Thank you all for what you do behind the scenes. I'll never forget the day I got the call from President Rice Spearman to come to her office to talk about an opportunity. And it was a wonderful opportunity. I said one thing. I said, you know, I can't do this unless I have my team behind me. And in particular, one individual who, with me, has spent about half our time here since about the 1st of April. And that's Sarah Luton, who's the acting dean for school operations. Go ahead, stand up. They need to recognize you. But not just Sarah. My whole team is sitting right here, and they've all had a part in this. And so I want to thank Jill Russell, who's been knee-deep in bylaws and student handbooks and faculty handbooks and all that sort of thing that you have to have that are foundational to a school. And so I want to, would you all just stand up and let them recognize you? This is the F. Marie Hall group that, thank you so much. This is the group that, because of their solid and sound leadership, allow Sarah and I to do this very important task. We're honored to do it. We're even humbled by it. And they came today, and I'm so happy to see them. I almost ran out in the parking lot and hugged them all, but I don't know whether you can hug anymore. So, you know, we do in Abilene, I know, you know, so anyway. But I imagine there isn't a person in this gathering today that still doesn't feel the tremendous impact of COVID-19 and the pandemic that we went through. This wonderful faculty and staff have been enterprising in how they've responded, not only in continuing their education in this program, but in what they did in this community and many others to try and do the best we could to protect and preserve people's health and well-being in an awful time. And all of you all that are here probably had your own roles in that. And we have great opportunities to do more of that in the future. I'm confident of that because I'm getting a little old, and just in my career, we've had 9 different pandemics. We just haven't recognized them quite the way we did this one because of its profound impact. So I feel a great sense of humility as I stand here before you today and look out on this wonderful city of Abilene and beyond the places where people live and have their being. The Julia Jones Mathews School of Population and Public Health will be a beacon, and for us, the future, which will bring new programs, new graduates, and new discoveries. We understand the tremendous trust that has been placed in us by our students, by you, by stakeholders, communities, and people we haven't even yet met. And there will be those challenges, and I can tell you that we will instill in our students a commitment to keep sight of the very communities that they come from so they can return there and serve those communities when they're finished in their education. We think that they will be better equipped because they have 2 degrees, whatever their primary degree is, and then the most important one, which will change their perspective forever, to public health or population health, and they will inspire others to go beyond even where they are. While we do not know what challenges the future will bring, we do know that this is a great moment for us to be happy and prideful a bit, and to pay tribute to Julia Jones Mathews with the unveiling of the sign and naming. Your presence here today and your support for the school is very much appreciated. We'll try to show you that over the coming years. I thank each of you for answering the call and dedicating yourselves to this belief that we together are more, we are better, and we are ready for whatever comes our way. Thank you very much for joining us, and now I'd like to introduce to you Mr. Joed Cannon, Executive Vice President and Director of the Mathews Family Office. Thank you for being here, sir.
All right. Well, sometimes I feel like I'm over my head, and this is one of those moments. Aren't we grateful for this morning? The weather is just heaven sent. No wind, no triple digits. They're on the way, but at least we've got a respite this morning, and I'm so grateful for all of us here to enjoy this. I'll just say it is an honor and a privilege for me to stand here and speak on behalf of the family of Julia Jones Mathews, Judy Mathews, and for the family office on the 9th floor down at First Financial. I will say that all the staff in the office regards their work there as a blessing, one of their life's greatest blessings. Both the present staff and the staff that is here represented, but not in the office anymore. Larry Gill right there. So we've got Jeff Blanks and Elise Lewis and Brenda Castleberry and Barbara Roberts. And that's a happy family, and we're grateful to have them, and they're here this morning in honor of Judy Mathews and the Mathews family. I always run the risk, I know, when you're in something like this, that you're going to miss some people that deserve some credit, were part of the effort over a period of time. And if I miss anybody, it's Norm's fault, because he was the guy that gave me a bunch of these names and kind of jogged my memory. Thank you, Norm. So I start off with just the, I guess maybe 2 people who have been most responsible, even though they weren't here when all this started. And the leaders, I'm starting with the ones at Texas Tech. And that would be Chancellor Ted Mitchell here in the front row, who was then president of the University Health Sciences Center beginning in 2010. So he saw the development and led the development from the campus there and here in Abilene of both the School of Nursing and the School of Public Health. That was one of his targets. I remember him talking about early on. He wanted a School of Public Health at Texas Tech, and here we are. And the other one is not with us this morning, unfortunately. I miss Kendra Burris. I really would like to have her here. So Kendra is Ted's closer. He sends her out, and she can close the deals with guys like Deezer and Tim and us. She's easy to work with, and so we miss her, and we extend to her our regards when you get back to Lubbock. Some of the others, we can't overestimate what Chancellor Mitchell and Deputy Chancellor Kendra Burris have meant to the development of these programs here. We wouldn't have been where we are today without those 2 leaders in our midst. And of course, Lori was behind the scenes there, but she was, I know, a part of it in her provost role during those years. But the folks here, some of the other ones here from Abilene, of course, there was Larry, who was part of the Dodge Jones team and worked with Texas Tech as an alum, a dedicated alum, during all the development of these projects. And there was Scott Deezer, who played a key role as a regent for about 5 or 6 years there, and also as a community leader at the bank, that his influence spreads far and wide. There's Tim Lancaster, who was, his tenure at Hendrick spanned the entire development from 04 to 18 of the development of the 3 schools here on this campus. And Tim also, by the way, was a regent and during a critical time in the teens. So he had to have 2 regents from this community at Texas Tech during the development of all this tells you something about their influence and leadership and role for Abilene, and we appreciate it. I also want to mention some of the other funding players that were involved in this. The Diane Graves Owen Foundation was a steadfast partner through, I think, all 3 of these school projects. Neither Tucker Bridwell nor Jane Beard could be with us this morning. They're traveling and involved with other commitments. Another key player was the Shelton Family Foundation, and Dave Copeland, representing the foundation, is here with us this morning. And we're grateful for Dave to be here and acknowledge his presence and their role in the development of these schools. Also involved was the Development Corporation of Abilene, and they were involved in each of these 3 buildings according to norm, and we can remember that they were key players, made commitments at critical times during the development of each of these schools here. So the DCOA was performing their role in the generator of economic development here. I know there's probably some others, but these were the steadfast, continuing players throughout the development of the campus here. So I look around, look at this beautiful campus, and I think of what it must have looked like, or what it did look like back before all this started happening. And I just a little prayer keeps coming, and I just keep saying, thank you, Lord, for the life and the legacy of Judy Mathews. She had her handprint on this as long as she was alive. She imparted her legacy. I guess the key legacy she imparted was to her children and her grandchildren the spirit of philanthropy and generosity and community service. That was what she demonstrated. That's the role she played. That's what she left to her family, and she learned it from her mother, Ruth Jones. So it's a long distinguished line of family philanthropy that we are seeing before us today. How consequential was her legacy, or is her legacy? I think, as was alluded to a minute ago, you look here on this campus and then you go in any direction and you drive around and you see her handprint on so many buildings, so many projects. You go down you go down Pine Street and you see the TNP right-of-way beautification. It was 83, 84, Dodge Jones Foundation and Judy Mathews. She hired the planter from Dallas, Texas, and then the city provided the labor. She provided the trees, the landscape, and so forth to make that happen over several years, several phases, all the way out. It was a linear, unsightly scar of red clay and gravel and weeds before the beautification that she undertook in partnership with City of Abilene. It was ugly. It was ugly. It can look better than it looks right now because, as soon as it rains, the grass comes out. But right now, it's a little dry looking, like everything else around here. So yeah, you had the right of way. The Community Foundation of Abilene, she seeded with money from Dodge Jones Foundation, and herself individually. I believe it was $750,000. It was 85, 86 time frame, and that's grown to $180 million of assets now, and with impact all over town and in the rural areas around this town. So the Community Foundation, a great jewel in Judy Mathews philanthropy. But then you drive up Cypress Street, and the whole west side of Cypress Street, from First Street and down there to the TNP Depot that she was involved in, coming all the way to the Gracie Museum, the Cypress Street Station, the DCOA building where they're housed now, the Center for Contemporary Arts, the United Way building, and the crown jewel of downtown Abilene, the Paramount Theater. It's like a magic kingdom when you walk in that theater, and they're playing Hello Dolly right now, and it is great. It is really good. So she planted the seeds for the downtown revitalization, and the cool thing is that it has been now passed along to other businessmen and families and companies in Abilene, and they're picking up that mantle, and they're doing things in other buildings that further enhance what she started back in the mid-'80s. So it's just been a win-win for Abilene, and it's a whole different looking downtown than what it was 30 years ago, thanks to her vision and her philanthropy. So yeah, I would say I don't know of a more consequential person in the history of Abilene, or family in the history of Abilene, than Judy Mathews, her mother Ruth Jones, and the successor generation that's coming along now with their generosity. Nothing has transformed Abilene, no one, as much as she has and her family has. So we come to the campus here, and we ask, what is the genesis of this? Well, Norm remembered, Larry will remember, back in 2004, she was casting around for probably one magnum opus legacy of philanthropy, a great work to leave behind to the community. And she really wanted something tied with education and economic development. So she sought out ideas from the institutions here, the universities and Hendrick, of course. And it was Michael C. Waters, the president and CEO of Hendrick at that time, who came up with the idea of a pharmacy school. And he presented the case. There were only 3 schools in Texas at the time. He presented that case, and she latched on to it because it was a public, it was higher education. It was, more importantly maybe, it was in the professional health sciences area. It would, with students and faculty, bring in economic development through a multiplier. And finally, it would lead to a beautification of an eyesore along Pine Street. So it checked all the boxes in her mind. So it got started, money raised, the partners I mentioned before helped fund it, and in 2007 that opened here, the first one, the School of Pharmacy. And then after Ted Mitchell came to Tech in 2010, they started a groundswell for a school of nursing, a much needed school of nursing. So that got rolling in 2014, according to some notes that Larry Gill provided me yesterday from a handy diary of his, that Kendra Burris came down here and saw us, and she started working on us. And so pretty soon we had Tim in the picture, and we had Scott, and of course the Dodge Jones Foundation, and the ball got rolling, and groundbreaking. Let's see, that opened in 2013 with the School of Nursing. And then just kept, kind of pushing the envelope. Dr. Mitchell did, and sure enough, we were presented with the idea. Well, Kendra was involved in school public health in 2014. That's when she started talking to us about it, and so we liked that, and it moved along until finally, in 2016, they opened the doors for the School of Public Health. It's hard to believe it's been about 6 years ago. So that's kind of the executive summary of how this all came to be here. The players involved, the team involved, we couldn't have done it without a collaborative effort with honor and civility and dignity among all the players. Nobody's ego was involved. It was all literally a team effort. And so that's where we stand today. And we're, according to Dr. Lori Rice Spearman, we may have some more coming ahead of us one of these days, and we'll see how much dry powder's left in Abilene, Texas. Keep oil prices over 100 and it would help. So I'll close these remarks. I want to quote from page 136 of Jay Moore, our resident historian's just excellent book called Legacy, the Dodge Jones Family and Foundation. And he sums it up in better words than I can. So to quote from Jay's book, which I'll highly recommend to anybody who hasn't seen it, you probably can find it down at the Texas Star. And I'll digress. It has photographs in there that dramatically show the difference between on the before and after. He's got a juxtaposition of the right-of-way and of some of the buildings downtown before Judy Mathews got hold of them, and it's just dramatic. It's breathtaking, the difference that it made whenever this lady got involved in downtown Abilene. So Jay says, if Judy Mathews could reflect today, looking up and down Pine Street from the Health Sciences Center campus, she might well consider this her signature legacy. For in this marvelous showcase of her magnanimity was a panoply of her lifetime passions, beautification and renaissance of a blighted corridor to downtown, education and training of young healthcare professionals, and an economic engine of development through well-paid jobs and higher learning to elevate the quality of life in her beloved hometown. Indeed, a tour de force of her philanthropy. That's it. That says it all. Thank you all.
Thank you, Joed. Beautifully shared and beautifully said. So Joed touched on this just a little bit, and now's a good time for us to talk about the vision of the economic impact and what would happen in the Abilene community if we were to bring the Health Sciences Center to this community. We just engaged in an economic study as a system, as well as individual universities. And then for us as the Health Sciences Center, we asked them to break it down by our communities. It's very common when we come into a community for us to be, if not the largest employer, one of the largest employers in those communities when we join them. We're happy to report that at our last economic report, our impact here in Abilene is right at $56.5 million for this community. And we're also employing almost right at 500 individuals that interact in some way with the Abilene community and the school. So we feel like we're honoring the vision and the commitment of what it is that we want to accomplish and what we do when we come into these communities. Before we move on, I just want to tell you that we have great plans for the Amarillo community. We're going to celebrate the Julia Jones Mathews School of Population and Public Health today, and we're about to do the unveiling of it. But we also have our eyes planted firmly in the future of what's going to happen in Abilene. As I've touched on a little bit before, we know that the future of healthcare is in innovation and collaboration. We know as a university that we have to partner with our healthcare partners here, Hendrick, and also the other universities in this community, because the future of healthcare is a technology-enabled healthcare ecosystem, and we have to prepare our graduates and our practitioners for what healthcare is going to look like in this community in 10 years and in 20 years, and we're only going to do that through collaboration and innovation. Before we close and we invite the family up here for the unveiling, I want to celebrate something that was very important, and maybe the Abilene community wasn't aware of what happened. We received our first National Institute of Health Cancer Research Grant, which is one of the highest honors that you can receive that recognizes your quality and level of research right here in the Abilene community among our cancer researchers. There are patents that are coming out of the Abilene community in the care and research of cancer. We are doing what we need to be doing. So thank you so much. I want to invite the family. I think we're going to come right up here. Where's Cindy? Cindy's going to tell us where she wants us to go, and we're gonna make sure nobody falls off the roof of the building. I think we're going to come right over here, Cindy. Where would you like us? Right over. Are y'all ready? Come on up. Okay, they want me to do a countdown.
I would invite you all to come out from under the tent if you'd like to, so you can see the unveiling as well.